there's probably a number of things that frustrate me, but the two that always kind of come top of mind is one, how how often I see that the solutions that are available to people out there were not designed for them, but they were designed, more for the interest of payers or for the underlying providers or health systems that are delivering the care, or some other entity, but not people. And the result is, I think the frustration that I often see is, people not getting the care they need, and that the blame is often put on the foot of the individual or the feet of of people, and that they often say, if people only, weren't so lazy and weren't so kind of uninformed and those kind of things, the system would act better. And so I think that's the biggest point of frustration, that how often what I see is this failure point, that care delivery in the U.S. is not oriented to the needs of people, to the consumer, of the individual, and it isn't designed around their needs. It absolutely is not affordable. And health insurance doesn't help that, meaning health insurance actually often complicates that. You think, well, health insurance is there to help people pay for stuff. It's not how it works. And then obviously with the rise of the high deductible plan and other things, the basic stuff that people need, the basic care people need, is often out of reach from an affordability perspective, and the accessibility perspective, and so I think that's probably one point of frustration, is that the entire basic care delivery system, we haven't designed it in a way around the needs of people. Instead, and I think a good example of that is you look at the regulatory realities and often protectionist policies around certain provider groups. Kind of pre-COVID, the limitations on practice, on what a nurse practitioner is allowed to do. But what we know is what they were trained to do, what they're clinically capable of doing, is up here, but often regulation only allows them to operate here. And so this idea of if we were really sort of doing things in the interest of the consumer, we would attempt to have regulation that enabled people to have better, more affordable access to care, and that it wasn't harder to do that.